Thank you very much. We are here at 12:01 according to my time, so we're gonna kick off, and I just want to thank you all for joining. This is a very exciting opportunity to hear from one of our very own, who's a global expert on this topic. I just wanted to make a few general points for the audience today, and then we'll kick right into it. For those of you who've I've not had the pleasure of meeting, my name is Dalai Fazio. I graduated with my MA in 2006, took Dr. Huang's Global Health class, and I serve as your Alumni Association president. So I want to thank you all for joining and recognize the other Alumni Association board members, Erica Rodas, Craig Whitmer, Freedom Kai Phillips, who are on the line right now. I don't think I saw anyone else from our board. Nope. So, but thank you very much for all the organization, everyone's hard work. Two things at the top of the call. For those alumni whose organizations are in hiring mode or have opportunities, we are really trying to make a concerted effort to connect job openings with our community and with the students who are soon to be graduating. So if you do know of opportunities, if you have posts to share, please upload those to our LinkedIn group or send them directly to me or Dr. and Catherine Ruby at the School of Diplomacy. And also, secondly, the Alumni Association has formed a new student recruitment committee to work closely with Assistant Dean Daniel Christo. We already have some volunteers, and if anyone is interested in contributing to that effort, sharing their experience with the school and speaking to potential students, please reach out to me or to Daniel Christo directly. We'd love to have your contributions. So, without further ado, Professor Huang is here to speak with us about COVID-19 pandemic. He joined the School of Diplomacy and International Relations in the fall of 2003. As many of you know, he directs the Center for Global Health Studies at the school. He's a senior fellow for global health at the Council on Foreign Relations, and he has delivered expert testimony to the U.S. Congress several times, and many of you have probably read his insights in many prominent global press, including CNBC, Bloomberg News, the New York Times, South China Morning Post, and many others. So, Professor, thank you. Thank you for your time. Thank you for speaking with our community. And I thought I'd just lead off with a little bit of a framing and a question for you. Today, we passed 30 million cases of COVID-19 globally, over 180 countries and territories, and testimony earlier this week from the CDC directors portends that a potential vaccine will not be expected to blunt this crisis until Q2 or Q3 of next year. Last week, Dr. Tedros, the WHO Director General, mentioned that COVID-19 is teaching us all many lessons. And he cited a few lessons. One is that public health and public health preparation is the foundation of social, economic, and political stability. And he called out many countries that are doing this well. Mongolia, which despite its neighboring border with China, didn't report its first case until March and still has not reported any deaths. He cited Uruguay, Pakistan, Cambodia, Vietnam, and others who really learned from lessons of previous outbreaks, SARS, MERS, polio, rubella, etc., Ebola, and made enormous advances in strengthening their health systems. But what we've seen is maybe in developed countries, while they've made enormous advances in medicine, they've neglected basic health systems. So maybe I wanted to start off with you about a question of lessons learned here. What would be some of the lessons you've learned here, or some of the lessons that you wished people had learned from your previous research?
Okay, well, thank you, Dali. Well, this is a great question, actually. Good to see you again. I still remember that you actually this morning I just went to that the folder that contains the files for that class that you enrolled, and I found two of your essays. That. And my comments there, both you received, I thought 95%, both of you. Yeah. So you're one of our best students. I still really. So we're very proud of you and the other alumni, really. So I'm glad that you mentioned Tedros' remarks. The importance of public health preparedness. I think public health preparedness is important but I don't think that it can be the decisive factor in terms of explaining why Mongolia is more successful than many of the countries worldwide, right, in containing the spread of the outbreak. We know it has a near like rudimentary public health system. Right? So how come it could be so successful? And I doubt it's because of their robust public health system, healthcare infrastructure. Actually, it just occurred to me. I think in this case, I mean, to respond, the COVID-19 outbreak, I think the most important factor is to respond early. Taking you might call it draconian, but just the needed the public health containment measures. I think that is the key, right? Because for that kind of virus, right, if you could just ask people to stay at home, get everybody like staying at home, quarantine, not traveling around, they essentially right after I was at most 10 weeks. That was what happening in China, right? The virus won't have any place to, that there any room to spread, right? It's going to die out naturally. This is exactly what happened in China, right? So in Wuhan, by the end of March, pretty much it was virus free. So within 10 weeks, China was able to contain the spread of the virus, although they still there's some sporadic, isolated outbreaks, but it's essentially has placed the situation under control. So what if you look at the toolbox, right? The methods they use, but instruments, right? Really are not something really that fancy, it's the same approach that was used 670 years ago. And I'm talking about the bubonic plague, when they started to experiment those methods like quarantines, right, isolations, sealing of cities. The same approach, right? Is still fundamentally the most effective approach to containing the spread of the virus. So, but unfortunately, right, in a liberal democracy, right, like the United States, even though we have a robust public health infrastructure, even we have all this advancement in medicine, in public health, right? This certainly helps, but because we have a system, I mean, political system, that make it very difficult to have a centralized, coordinated response, to the outbreak. So even though we are now 6 months into this pandemic, like we have that so-called social distancing, right, still in place, for more than 6 months, still that is not very successful, right? Because we cannot effectively implement this approach. I think that is the key.
So going forward, countries are now thinking about second wave, and whether or not they will have to return to the draconian policies that you cited, which were we can't argue with the results. They did squash the virus spread. I noticed in your Twitter feed that you pointed out that China was keeping those temporary massive field hospitals that they built in the matter of 72 hours, erected for the time being, just in case they need excess capacity. Certainly there's other practical steps countries could take. If you were advising others on preparing for the for a second wave, what would be some of the public policy steps that you'd recommend?
Well, again, first of all, thank you. Well, first of all, we don't know whether the second wave is going to come, right? And secondly, if it indeed comes, what will the second wave be like? Is it, going to be more lethal? The virus become more transmissible, right? Because we know what we have, this history can provide any guide. Well, it's 1918 Spanish flu, right? The second wave that arrived in the late September 1918, turned out to be much more lethal, right, than the first wave earlier that year, I believe in the spring. And most of the damage, most of the fatalities occurred in the second wave. So, if we indeed have a second wave, well, the virus becomes more lethal or more transmissible, that could make, the current medical countermeasures of potential medical countermeasures like the vaccines, would render them less useful, right? And I think that will be a disaster. It is going to, we're not just talking about the impact on the human life, human health, right? More fatalities, more cases. We are talking about the impact on the society, right? The impact on the economy, impact on international relations, impact on the political systems, which I think we are not ready actually to handle. Such a devastating, second wave. And certainly, right, that I think you could make, certain preparations, like, having more ICUs, hospital beds, makeshift hospitals, available, for dealing with such an outbreak, to avoid being overwhelmed by all those, demands for healthcare. But I think that if the second wave, such a lethal wave, such a devastating one indeed arrive, I don't think that this would be sufficient. We're talking about, if you need to prepare, it got to be a holistic approach on all fronts. So public health preparedness is important, but it won't prepare us, for prepared us economically, politically, psychologically, for such an outbreak.
Yeah. And folks, if anyone on the line has a question for Dr. Huang, you're welcome to use the chat feature, or please just raise your hand in the toolbar on the bottom of the screen, and we'll get you unmuted and on the screen here. Maybe Dr. Huang, before I jump into my next question, Freedom, please.
Thank you, Dala, for coordinating this with the university, of course, and Dr. Huang for joining us. Kind of jumping off of your last point, as we come out of the pandemic, while we don't necessarily know what the timeline might be, there is going to be a need for economic recovery efforts, large-scale stimulus packages. In your view, what would be the type of advice you would provide to lawmakers in the formulation, prioritization of those stimulus packages to be able to both prepare for something like this in the future, but also build back better in many respects, so that we are reshaping our economy to respond to what the future needs and future priorities might be?
Great question. Thank you, Freedom. Good to see you again. I think you're right. We need to, even before you don't want to wait until the pandemic is over, right, to plan for the recovery of the economy. I think it is important, to I don't claim I'm an expert on the national economy, world economy, because I'm not the economist by training. But again, if you look at the history, right, this is the one pandemic, right, that is different from the previous epidemics in that it does not only affect, right, the demand side, right, in terms of like people's demand, for consumptions, right, using entertainment venues, right, for example, it is also going to affect the supply side, right, given this the impact, on the supply of the labor, right? This could be caused by people become sick, and by people the absenteeism, right? The all these factors, so a stimulus package, if any, you have to take into account, right, this impact on both sides. But in the meantime, if you what is happening in China seems to be offer some optimism, on so in terms of the resilience of the human society. If you travel to Shanghai, well, certainly you can't, because unless you're a Chinese citizen, right? According to the observation of the Wall Street Journal reporters, right? Essentially, there's no, you don't see any trace or sign, that there was any pandemic. It happened in the city. People are just, the business essentially go back to normal. That the society, people, go to the restaurants, they go to the shopping malls. That some may still wear masks, but in many places they no longer even wear masks. So I think the human the social resiliency, cannot be overlooked. So in 1918, during the Spanish flu, there were the states that were worst hit by the pandemic turn out to experience fastest growth in income per capita, in the immediate aftermath of the pandemic. So that gives us a certain sense of optimism. But I think it is time, that for the U.S. to plan ahead, or to start to stimulate the economy. But in the meantime, I think it is important for the U.S. to work with other countries, including China, right, to evaluate, right, the impact on the world economy, and also figure out a plan, on how to stimulate the world economy. This they did in 2009. After the world financial crisis, that we found the United States and China to actually work together to boost the world economy. But unfortunately, such a dialogue, it's seems not happen, and I don't know when it could happen, but certainly not during the election period. You probably have heard, right? The Commerce Department just banned TikTok and WeChat. That. And probably you're going to see more, surprises in the near future, right? So all this probably will have to wait until after the December 2020.
Thank you. So, Dr. Huang, you talked about the global cooperation there, and public health systems, have been built on multilateralism, at the very least bilateral cooperation, for decades. And I think, depending on what news you read, the image of or the brand of the WHO has been manipulated, whether fairly or unfairly, as a result of this COVID crisis. Do you think that is it fair to criticize the WHO for its early response, and what steps might the WHO need to do to sort of regain its credence?
Well, thank you. Yeah, well, this, I've been critical of the WHO for many years. So that I think if probably if they have a chance to read my publications, they would be tedious. I think probably I have seen my the Twitter, the tweets, the posts. He's not going to like it. That. But to be fair, that this is not just like his problem only, right? This is that we're talking about the structural institutional problem. That this organization was built, right, as a member state organization. They're supposed to defer to member states in the decision making. Not actually not just like bigger states, major powers like U.S. or China. We're talking about even to smaller powers. That was the case in 2014, the Ebola outbreak. The WHO's hobbled response was in part a result of the affected countries in Western Africa. Did not want the WHO to declare it a public health emergency of international concern. We saw the same thing, right? During the 2000 the COVID-19 outbreak. When I remember it was on January 23rd, right, when the WHO Emergency Committee first met to discuss whether they need to declare a fake public health emergency of international concern, right? My colleagues and we all, agree, that the conditions for declaring a fake had been met, But to our big surprise, they decided, well, not the conditions have not been made, So that was that was so in part because, right, as many global health experts pointed out, the opposition from China. Yeah, but somehow there was this very strange, well, you could call it a rumor, before that meeting, there was in China, we've seen the social media, even government publications, they spread this, news that the year WHO declared China or declare the COVID a public health emergency, and China will be declared epidemic zone. There will be no economic connections between China and other parts of the world. That kind of rumor. I don't know to what extent have actually affected the leaders, right? The thinking, on Chinese leaders, the thinking on the this WHO decision, and then sort of encourage them, to exert pressures, on WHO secretariat. But this is just an example, that again, well, the issue is, I think fundamentally is an institutional one. But that said, there's indeed room that allow the WHO to have certain autonomy in pursuing its policy, a more sort of proactive policy in dealing with the outbreak. We saw that in 2003, for example, under Group Brundtland, she was very aggressive in terms of pushing China, to be accommodating to WHO requests, and indeed China deferred to the WHO demands in terms of allowing the WHO sending teams, to Guangzhou to do the investigation, in terms of that being more transparent and cooperative, right, in announcing the disease, in sharing the disease-related information. So the leadership, right, would be another factor, right? That you need to have someone who a WHO DG, for example, who can or who is willing to exercise that leadership, right, to show determination, to even though that might sort of upset the leaders, of affected countries, but here it also requires, the ability, right, of the leaders to have the ability to take a fine line in terms of balancing the request, not to to be determined, to be to demonstrate leadership, right? And in the meantime, not to rock the boat, still you should provide incentives for the affected countries to cooperate with the WHO, especially for a bigger country like China. So that that further tested the leadership capabilities, and unfortunately, right, this in the beginning stage, we haven't, seeing that kind of leadership being undertaken. In fact, we only saw the reputation of the WHO being badly tarnished, and certainly it didn't help when the WHO first criticized the United States and other countries for instituting, those travel restrictions, right? But then it turned out, well, this is actually indeed necessary in order to effectively prevent the international spread of the virus.
Yeah, thank you. I want to turn to a question from one of our audience members, Kamlan Avolet, a graduate student at the School of Diplomacy. It reads here, Dr. Huang, it seems as if the virus has a less of a death rate in Africa than predicted by experts. What do you think are the factors that perhaps are playing into the less fatality ratio that we're seeing in Africa? I actually spoke to a UN peacekeeping officer who's in South Sudan recently, and I said, what happens when it comes to the refugee camps there? And he gave a little bit of a cavalier attitude response to me, but he said, they'll be fine. I said, what do you mean by that? He said, oh man, they have the strongest immunity in the world. So I guess I'm wondering, what are your thoughts? Why are we seeing some real relative success or holding off of high fatality rates in Africa?
Oh, great question. Well, this is I'm not the epidemiologist, and I don't think there is any convincing explanation on this, uneven distribution of the cases, in different regions, and why some regions, some continents, seems to be less affected by the outbreak. Certainly if you look at Africa, right, there are just so many factors there, that would make the rapid spread of the virus more likely and would make the impact much higher, right? If you talk about the poor public health infrastructure, the state capacity issues, right?
Dense urban areas, yeah.
Yeah, and in the meantime, right, you also have the factors that might make the spread less likely, right? First of all, they have a relatively young population, right, compared to Europe, but certainly by the United States probably is not. It's sort of an outlier, but even compared to China, right? I think the people who are aged over 65, they only have like 5%, something like that. So that is much lower than European countries, like Italy, they have like more than 20%, right? Germany, I think it's probably 18%. Even China has more than 10% of the population aged over 65. We know that the younger populations tend to have more robust immune systems, right? And this virus, is not like the 1918 Spanish flu, and that even though it causes what we call cytokine storm. That is, if sometimes your immune system could become your own enemy, right? Because if your immune system overreacted to the infections, that would actually causes the cases to become more severe, even death, right? They would be that would lead to death. But in 1918, the problem is that if you look at the epidemiological patterns in terms of the death rate, right, certainly you have the very young and the very old being the victims of the virus, but those who are also in their prime age, right, like the people aged between 24 and 35, I believe, they were also the victims of the outbreak. But this one, we so far we haven't seen such a pattern. That so overall, you have better immune systems, right? That you're more likely going to survive, in the outbreak. So that is one reason. Second reason might be the case that it may be also population density could be a factor. Right? We know in many of those African countries, right? I still need to see compare the data, right, in the urban cities and the rural areas. But usually, in the rural areas, when you have a more like scattered population, therefore interactions between the people are relatively rare, so the chances for the spread of the virus also are relatively low. But this is just my hunch. I think it is still that it remains to. I think scientists, researchers, still, I think, needs to conduct more research to find a more convincing explanation. One thing that is clear, right? If you look at the 2009 H1N1 pandemic, 2003 the SARS epidemic, it seems to have spelled Africa as well, right? So we're not just want to, and if you want to find an explanation of why, right, there's less the impact on Africa, and that explanation should also be able to should also be valid, for explaining the previous, outbreaks as well.
Yeah, thank you for that. I think you're right on the age, the demographics of and proportion of age being younger definitely has a factor. Maybe we'll touch on a bright spot. Freedom used the word "build back better" earlier in his question, and I was curious, what were your points of view on the jobs of the future that may come out of this? Certainly, global health is going to certainly have a resurgence in importance in the next few years, and there likely are brand new job titles. Contact tracer being one of them, or
emergency
pandemic
response.
Yeah, absolutely. So this is going to create a whole new wave of pandemic response resiliency planning, economy and new jobs for people who want to work in this space. What are your thoughts on that? If you had to speak to a young audience like this, of individuals interested in international relations and global health, maybe what are some of the steps or some of the new career paths that you may see come out of this?
Well, if you're studying international relations, we don't have the we're talking about relatively narrow, right? The career choices. I would, as I mentioned in that the interview that is published in the Foreign Affairs, the page, right? I said, I expected that in the coming 5 years, right, almost all the schools of international affairs may have a academic concentration, on global health, right? That is, they're going to have this, this academic concentration or even majors, right, who are examining health issues from foreign policy, governance, or national security perspective. So it is important, I think, if you want to make you more marketable. I think it makes sense to have a certificate, right, in public health, right, or you have the certain training in diplomacy, international relations. That would be make you more marketable in terms of applying for government jobs like Homeland Security, the HHS, and DOD, and also at the local level, right? Because even though I think the main interest is like the local, national level outbreaks, but we know that the pandemic or disease outbreaks do not respect territorial borders, right? So, having, even for them, I think they should have an interest in people with international relations background, right? In the meantime, I would expect, many of those, multinational corporations, not just like a big farmers, they are, that their government department will be interested in people, who have this expertise in public health and international relations, and especially given that this disruption on the global supply chain, I think they do need people who have expertise in those areas. So yeah, well, I stopped there.
Yeah, you're a proponent, you're a cheerleader for public health, global public health jobs for sure. And I agree with you. It'll certainly burnish your credentials to if that's where you want to go, to have that certificate or have that specialization. We haven't really discussed the U.S. response or the U.S. situation in depth on this chat yet. It's actually quite painful, probably for many of us, and very painful for me to do so. It's I would say an international embarrassment, to use my words. But we do have a question from Erica Rodas, who's our communications chair on the Diplomacy Alumni Board, and I just want to tee that up for you to say, what do you think are the next steps to contain the virus in the U.S.? I was listening to Dr. Fauci last night, and certainly he's advocating more nationwide adherence to masks. More states to have nationwide restrictions on public gathering spaces, restaurants, bars, outdoor events. But it's a difficult situation, whereas public protests that took place over the summer were roundly supported by many but criticized by others, whereas someone gathering for a non sort of free speech event was criticized. So it's a very difficult situation for many public policy makers and governors to be in. But if you could be additive to Dr. Fauci's advice, what would be some other things you would recommend as next steps for the U.S. as we come into the fall and winter?
Yeah. Okay. Well, I think it is indeed an international embarrassment, right? The 2009, where the two institutions, I think NTI and Johns Hopkins University, developed this global health security index, basically to measure a country's preparedness. Actually, the U.S. scored one of the highest. So that means that you return to that back to the issue of preparedness. We were the considered the best prepared, right? But it was precisely right this most prepared nation that actually had the one of the poorest record in dealing with the outbreak. So that is already the costing the U.S. The soft power overseas. As I pointed out in a recent piece in foreign policy. Now. That if you look at China, even among the young and educated people, we're not just a hostile power, we are also a diminishing power. So they're just not just a dislike, they also despise us. So it is rather unfortunate, right, that this pandemic has has really cost the United States its international influence. It's tarnished its international image. Right? And sometimes, as often, I was just thinking, that we don't have to stay, right? Like to be like this for more than 6 months, right? If we had that capacity, right? If we have that resilience, if we had that social cohesiveness, right? We just adopted the Chinese approach. That maybe not Chinese approach. South Korea approach, right? Of implementing effective social distancing measures, right? That include asking people to wear masks. That include to limit the people's movements. And conduct mass testing, right? Contact tracing. Right? I think if even we started doing that in March, I think by June we should have been placing the pandemic under control. And that would really, right, that's be considered a big achievement for the United States, and therefore also would be used to counterbalance, the Chinese soft power. So but that didn't happen, unfortunately, right? There's too many reasons, that this protest, as you point out, might be one of them. So now, is it too late to adopt these measures? Well, it isn't. I think we still have a chance, that to contain this, to ultimately contain the spread of the virus. Right? But the question is that it's a matter of time, because the virus, but like any outbreaks, it come and goes. They come and go, right? So. It's just that the wane, with the current mode, the current approach, I think we may have to learn to live with the virus. It's not going to go away automatically. Right? Look at New Jersey, right? That after that many months, we're still, right. If you look at the transmission rate, R naught, which is used to measure the transmissibility of the virus, it is still over 1. That means the virus continue to spread. So it really, I think, takes time if we adopted this current approach. So I think we've got to be more aggressive. That. In terms of mandating, making mask wearing mandatory, in terms of the asking people, to pay attention, to those personal hygiene, measures, like washing hands. In terms of more active, more extensive, testing and quarantine, that might be too unrealistic. But hopefully we will have a vaccine in place, by the end of this year, right? I mean, a safe and effective vaccine in place by that time. So given the unavailability of those therapeutic means, and given the infeasible, the unlikelihood of having a natural herd immunity, right? So the vaccines will be, I think, most effective medical countermeasure, right, for us to finally contain the spread of the virus.
Mm-hmm. Yeah, I made the prediction. Made the prediction that if Trump solves this problem, I said in March, if he gets this right, he'll win the election in a landslide. Despite anything else, he'll win. It was my prediction if he gets this right. We could have had a very good story, a good example, as you say, a good counterbalance or counterpoint to the Chinese model. Wonder what you think about that. If that could have been a reality too.
Yeah, well, you might have read that I just ordered that book, The Rage by Bob Woodward. And I was frustrated when seeing that President Trump admitted that he knew the severity of the outbreak in February, but he chose to downplay it. That is another because someone who's critical with China's mishandling of the outbreak, say, well, there's this issue of lack of action. There was this issue of cover up, right, in China's, initial handling of the outbreak. But now, seeing even the president of the United States himself was doing the same thing. I asked that question in my Twitter, right? So is there a fundamental difference between authoritarian so-called communist states and a liberal democracy like the United States, right? So the I really was dumbfounded, when that there was nothing more to say. That it is actually. I feel like all this research I have been conducted by trying to say, well, China, you need to not just to improve your public health infrastructure, you need to fix your political system, right? You need to, because the root cause of your problem is political, institutional. But now, right, the people could easily make this counter argument. But look at the United States; they were doing the same thing, right? So I still need to figure out how to sort of make peace with these two developments.
Yeah, that's difficult. Folks, we have Dr. Huang for about 10 more minutes here, so if you have any other questions, definitely please get those in. Raise your hands in the menu, or add your question into the chat feature. And do appreciate a question here coming from. Oh, lost your question. There we go. Coming from Norhal Seber, a senior, and currently in your course. So since we mentioned the 1918 Spanish flu, he says, we discussed that state leaders were worried about their international image and therefore were aware and allowed misinformation to surface 100 years ago. I guess his question is regarding if the United Nations can ensure that political leadership takes accurate measures for their nation's safety and can guarantee accurate reporting, I guess accurate medical reporting or scientific reporting on the cases. Do you think the United Nations has that ability to ensure compliance?
So far they haven't demonstrated that ability. That it is where we just talk about WHO, but we forgot the United Nations, right? Actually, it could have played a more active role in addressing the pandemic, because in 2014, we know that when the WHO was not doing well in dealing with the outbreak, the Ebola outbreak in Western Africa. The United Nations built an emergency committee called AMIA. I forgot, but this is if you are in the UN system, I saw that Dean Smith there. You have to deal with all these acronyms. The AMIA, right, that played a more prominent role in dealing with the outbreak, right? You would expect this time, the UN Security Council would, immediately reach a consensus, right? How they could work together, right, in handling the outbreak, but that is not the case. Instead, we saw this great power disagreement, especially this between the United States and China, actually had hindered effective UN response to the outbreak, right? There was not even a resolution, right, from the United Nations, but regarding the outbreak. Why? Because I think the Chinese government said, this is not the place to discuss the problem, that is not a national security problem, and the United States insisted that the resolution to include the term. Well, this is according to the Chinese sources, right? They say the United States insisted that the resolution they should include terms like China virus in the resolution, so they couldn't prove that, right? So it's just this is rather unfortunate, right? Because this blame game, there's the finger pointing, unfortunately, have prevented the United Nations to play effective role in coordinating international response, to the outbreak. Right? If you guys, not if you guys have learned from the school of diplomacy, right? That the international relations theory, right? The neoliberalism, they highlight the importance of international institutions and international organizations to facilitate international cooperation and coordination. But if there's international organizations or systems or institutions themselves do not work, then you don't expect the effective international cooperation, right? That's simple.
Understood. Well, maybe in the 5 minutes we have left here, I might try to turn to a positive note. And I have 4 children, and so this week has been back to school week.
Congratulations! I didn't know. You're certainly very productive.
That's a good word for it. But so we've been participating in back to school nights and Zoom meetings with our the children's teachers in the evening, and remarkably new terrain for us. But I was struck by what one of the teachers said, and I thought it was very optimistic. She said, I'm trying to find the silver lining here. And she said, one of the silver linings is that, and she was talking about the schedule for the day. She said, I now get, 45 minutes to an extra hour each day to have small group work with only 1 or 2 children on our Zoom meeting. Whereas if I wanted to do group work or have one-on-one time with a student in the classroom, I had to always have my eyes on a swivel, my head on a swivel, looking at the whole other class. And I could really only spend a minute or 2, or maybe 3 minutes tops with any one student in the course. And now, she said, I get so much more time to give students individual help. And I was just struck by, this is true. She's going to have much more time to help them and identify learning, barriers or places they need to catch up, et cetera. And that potentially could be a really great thing for all these little grade school kids. So are there any silver linings or positive points that you can draw from this that you'd love to see continue going forward and far beyond the restaurant pickup curbside pickup, which I hope never goes away. But going forward, what do you think are some of the positive things or positive innovations that this disruption has accelerated or caused that you're happy to see and hope remain?
Wow. Well, that well, that is a tough question, I think. Well, certainly, well, you could identify some of these the positive developments in the outbreak, just like the one that you referred to. I myself, I found that I could spend more time that doing my research or doing media interviews. That is, well, actually, speaking of media interviews, that's something I think the convenience offered by the pandemic is that you don't need to travel to the studio, right? To do interviews, spending hours, on the road. Now you could do many interviews in one day. Well, my record of doing those media interviews, actually, I did like 8 or 9 in one day. That includes certainly both the TV interviews and the newspaper interviews. So that potentially could make you more efficient. But I still miss the days that without the outbreak, you could, have the chance to speak face to face, with my students, with the people, and you could travel, to different places, whether it's to attend a conference or just to do some sightseeing, with your family. I think it's been too long. We've been cocooned in our homes, So let's hope, that the pandemic could be over soon.
I agree. If anyone else wants to add something at the end of the call here, please do take advantage of this time and do so. I really enjoyed this dialogue. Professor, thank you very much for your views. I'm certainly hopeful that we can regain our, speaking from as a U.S. citizen, regain our soft power influence in the world. I think we have a lot of positive to give to the world, but I hope it also, this experience makes us more humble and also more able to accurately respect the power of viruses and public health risks, because I think many of our population's memory was just could not remember, of course, could not experience what 1918 or 1919 looked like, and for them this was just something out of the blue, something out of a sci-fi novel, and hopefully now it's come home, and it appears they know it's real, and we'll have a more serious response if this ever happens again in the near-term future. So, okay, folks, with that, I want to thank everyone for joining. We've a lot more to offer and a lot more to contribute to you as our community. The Diplomacy Alumni Association is here to help. So if anyone has any questions, wants to get active, wants to be involved, wants to connect with other alumni, talk about jobs, certainly you can reach out to anyone on the alumni board, myself, or our liaison at the school, Dean Elizabeth Halpin. So thank you very much, Professor. Hope you have a great day, and keep up the media. We really are filled with pride when we see your name in the press. Thank you for representing the school.
Thank you, Dale. Thank you, everyone, for coming, and I hope you are the very best. Keep healthy and keep safe.
Wonderful. Okay. Thank you, everybody. Have a great weekend.
Bye-bye.